Welcome to Woosh TV. In this video we are going to talk about top 10 shocking facts about coronavirus. So before starting this video, like this video, and subscribe to Woosh TV for future updates. SARS-CoV-2, a new coronavirus, has been responsible for an outbreak of respiratory disease, COVID-19, and pneumonia in Wuhan, China, for more than 17 months. SARS-CoV-2 has since spread over the world, sickening over 161 million people. You've probably learned more about viruses than you ever wanted to know. However, we continue to learn new things every day. Find out everything doctors know about SARS-CoV-2, and the condition it produces, COVID-19, including the odd symptoms and treatment options. Number 1. Anosmia, loss of smell, is a symptom. Fever, cough, and shortness of breath are among the most prevalent COVID-19 symptoms. However, as the disease has spread over the world, healthcare experts have observed certain unexpected symptoms, such as a loss of smell, anosmia, and a loss of taste, ageusia. The loss of smell was the first prominent symptom for 30% of patients who tested positive for the virus in South Korea. More than 2 out of every 3 verified cases in Germany involved a loss of smell and taste. Doctors advise anyone who loses their sense of smell or taste to separate themselves and notify their healthcare practitioner. SARS-CoV-2, the coronavirus that causes COVID-19, emerges from the surface of lab-cultured cells in a transmission electron microscope image. Rocky Mountain Laboratories, National Institute of Allergy and Infectious Diseases, NIH. Number 2, SARS-CoV-2 attaches to human cells firmly. SARS, or Severe Acute Respiratory Syndrome, was a disease that spread from Asia to the rest of the world in 2003, infecting over 8,000 people and killing over 700 over a 6-month period. Although the virus that caused SARS, SARS-CoV, and the one that causes COVID-19 are both coronaviruses, researchers have recently uncovered a key difference that may explain why the new coronavirus is so difficult to eradicate. SARS-CoV-2, the virus that causes COVID-19, attaches to human cells 10 to 20 times more strongly than SARS-CoV-1, the virus responsible for SARS. Number 3. Coronavirus can make babies seriously ill. Children appear to be significantly less likely than adults to become ill if they contract the novel coronavirus. The very young, those under the age of 1 year, tend to be more susceptible to serious sickness than older youngsters. Nearly 11% of sick newborns were very or critically ill, compared to 7% of children aged 1 to 5, 4% of children aged 6 to 15, and 3% of teenagers aged 16 and older, according to data from 2,143 Chinese children. From February 12 to April 2, less than 2% of cases in the United States were among children under the age of 18. Children under the age of 12 months accounted for 15% of the pediatric cases. Some children with current, or recent SARS-CoV-2 infection are developing a multi-system inflammatory syndrome, MIS. MIS is a rare yet dangerous condition. GI discomfort and heart, or other system, inflammation are common signs of MIS. The condition is comparable to Kawasaki disease, which can cause enlargement of the coronary arteries or even aneurysms. If your child develops a fever, abdominal discomfort, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or is considerably more exhausted than usual, call your doctor immediately once. Not every child will have all of the MIS symptoms. Number 4, the COVID-19 virus can survive for days on surfaces. COVID-19 is largely transmitted via respiratory droplets. When an infected individual sneezes or coughs, the virus can spread directly from one person to another, which is why the CDC recommends keeping a 6-foot space between people, or via an intermediary surface. The virus can also spread through the air, although it is more likely to do so in crowded, indoor settings with poor ventilation than in areas with plenty of fresh air and fewer people. The virus can survive for up to 24 hours on cardboard, and 2 to 3 days on plastic and stainless steel, according to researchers. The virus was found on the Diamond Princess cruise ship's surfaces up to 17 days after guests disembarked, according to the CDC. However, only fragments of the virus were found, not viruses that could infect a person. Number 5. People who are asymptomatic can spread the illness to others. 1/3 of 565 Japanese nationals who tested positive for coronavirus infection, and were evacuated from Wuhan, China in February never exhibited COVID-19 symptoms, according to a Chinese study, and more than half of infected children had no or just minor symptoms. According to the CDC, up to 40% of infected people show no signs or symptoms. This is wonderful news for the people who are afflicted, but it is poor news for public health, since people who are infected but do not show symptoms may unknowingly spread the virus to others. To minimize the transmission of sickness, public health experts are urging everyone to limit their social contact. When you go to a public indoor location, wearing a cloth facial covering protects others, because you could be infected and not realize it. Wearing a mask decreases your chances of unintentionally spreading the illness to others in the area. Number 6. People with type A blood are more likely to become infected. The number of sick persons with type A blood was much higher than researchers would expect based on the percentage of people with type A blood in the general population, according to a Chinese study of 2,173 people hospitalized with COVID-19. There were also fewer sick persons with type O blood than expected, according to the study. Genomic studies of patients from Italy and Spain have backed up these findings, revealing that patients with type A blood have a higher probability of developing COVID-19 respiratory failure. Number 7. It's possible that you've already been infected. Some people, roughly 20% of those affected, never show any signs or symptoms. And it's possible that some people who felt they had a severe cold or the flu actually have COVID-19. Scientists developed methods to identify SARS-CoV-2 antibodies in the blood, which indicate previous virus infection. Such testing may someday assist us in determining the true scope of the pandemic. If you suspect you've had the virus, ask your doctor or the local health department about antibody testing. Even if there are no symptoms, the CDC recommends virus testing for active infection for anybody who may have been exposed to a confirmed case of COVID-19. Number 8. COVID-19 can cause intestinal problems in some persons. The most common symptoms of new coronavirus infection are cough, fever, and shortness of breath, but many people also develop digestive problems, such as lack of appetite, diarrhea, vomiting, and abdominal pain. 48.5% of 204 persons brought to the hospital with COVID-19 had stomach problems, according to a research published in the American Journal of Gastroenterology. Simply a small minority, 7 persons, reported only stomach symptoms, with no cough, fever, or shortness of breath. Number 9. It's probable that you'll get infected again. Is a person who contracts COVID-19 immune to SARS-CoV-2 infection in the future? What is the duration of immunity? 4 separate coronaviruses cause 10 to 30% of our typical colds, and we all know that catching one cold doesn't prevent you from catching another. Doctors have confirmed less than 100 cases of SARS-CoV-2 reinfection across different nations. The risk of reinfection with SARS-CoV-2 varies from person to person, and is also dependent on the strain or variant of SARS-CoV-2 to which the person has been exposed. Natural immunity and protection against reinfection is thought to last 6 to 12 months in most cases, but some persons have been reinfected sooner. Number 10. The FDA has approved the first targeted COVID-19 treatment. Bamlanivimab, a COVID-specific medication, has been approved for emergency use, EUA. It's for those who have mild to moderate COVID-19, and are at a high risk of developing serious disease. The medication, a monoclonal antibody that targets the SARS-CoV-2 spike protein, reduced emergency room visits and hospitalizations in clinical studies. The antibody cocktail that former President Trump received when he developed COVID-19 in October 2020 was also approved by the US FDA Food and Drug Administration. The antiviral drug Veklury, has been approved by the FDA to treat COVID-19, however it is only available to hospitalized patients. In some circumstances, it has been demonstrated to improve symptoms and reduce recovery time. More medicines are currently being tested in clinical studies. What do you think about this video? Do let us know down in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.